So good morning. Thank you so much for having me. As you remember, my name is Creque, and I'm a grad student. And I'm here today to lecture on 2 chapters. We're going to talk about qualitative design and qualitative sampling. I'm really excited to be here as a grad student getting my master's in nursing education. And one of the reasons I'm excited to be here, by the way, I'm Creque, said that 3 times already. But one of the reasons I'm glad to be here is because I want you to know what your aspirations can be. I'm old. I've been a nurse for over 30 years. And I decided long ago that I didn't really need a master's in nursing. So I got a master's in something else. But then along the line, because I am a nurse educator, because I'm a director of a nursing program, sometimes we need to have that, just that little edge, if you will, and to know a little bit more. So for those of you that are just starting out in your nursing careers or thinking that, this is the end, like I'm going to get my BSN and that's it, you may. Or you may decide as you start to work and you explore other options and opportunities that you might need to go a little bit further. So I want to be the inspiration for you, perhaps, that regardless of age, because my oldest is older than probably all of you, and my youngest is younger than all of you, that you can really continue your education at any time. So at any stage of your life. So just kind of keep that in mind. Today we're going to talk about qualitative designs and approaches and also about sampling. And the objectives for today are to discuss the rationale for an emergent design and qualitative research and to describe those design features, to identify the major research traditions for qualitative research and the domain of inquiry for each of those, to describe the main features and methods associated with ethnographic, phenomenologic, and grounded theory studies, and to describe key features of historical research, case studies, narrative analysis. Okay? So there are some specific characteristics of qualitative research design. You've just gone over the quantitative, so I'm sure you remember some of those issues. Specifically, quantitative is where your research design is developed before your data collection, right? Makes sense. This is what I want to do, this is what I want to prove, and this is how I'm going to get there. With qualitative design, however, is quite different. The study design actually emerges as you are living, or as the researcher is actually processing information. Things start to unfold, and that's called emergent. Basically, your strategies or techniques may change based upon the circumstances or situations that you as the researcher come upon as a result of your efforts. So qualitative design tends to be a holistic type of design as opposed to looking just at one aspect. If you think about quantitative, researchers are trying to prove a particular thing, that one thing causes something else, for example. With qualitative, where researchers are looking at the entire entity of the phenomenon. Phenomenon is a big word that's used with qualitative designs. The researchers typically become very engrossed, intensely involved in the process, and you'll see why as we continue going forward. They do benefit from ongoing data analysis. They really become immersed in the culture in certain ones of them. Again, emergent design means design emerges or changes as the research is conducted. Strategies are introduced based upon data collected, and the researcher develops new insights as the research is conducted. And it's kind of interesting because as I was preparing for the lecture today, and I did a little bit of research on my own, there are different schools of thought about this emerging design component. Some people think that research is pure, that there's only one way to do it, that emergent is just, it happens and now we take it at face value, where other theorists or other researchers feel like it really is based upon the interpretation of the researcher. So the information that comes about, yes, that occurred, but how I as a researcher interprets that information is going to be different than yours, for example, and how we utilize that information is going to change the trajectory of our process or of our research. So that's kind of interesting, and I know some of you have chosen qualitative studies for your research proposal, and I'll ask you about those in just a few minutes. Now, this would indicate, or you might think, that there's no planning ahead of time. Again, you know, with quantitative, we know what we want to prove, we think about the design, we think about the sample size, etc. With qualitative, there is planning. It's not just haphazard like one might think. They have to look at the research traditions, and we're going to talk about those in a minute. Where is the research going to occur, the research site? What data collection strategies are going to give me the information that I need the most, and what equipment is going to be needed. And then we also have to plan for situations. Life gets in the way, you know, equipment may break, you know, the recorder is not paying attention, so they start a little later than they should have. You know, whatever occurs, we have to plan for. We have to plan to handle circumstances, because again, we're trying to get at data, okay? So the goal. Overall, the goal is to develop an understanding of experiences as they are happening, as they are going. Participants dictate the experiences by virtue of them living their lives. So one could say that I'm engaging in a qualitative study right now, if you will, because I have interjected myself into your class, your nursing class. I'm subjected to all the things that, except the test, I'm past that, thank God. I'm subjected to the same things that you are in relation to sitting, listening to lecture, being a part of the process. So one might say that I am living the experiences just like you are at this present moment in time. So, who has a qualitative research proposal? I remember somebody. Can you tell me what it is?
Well, I'm not sure if I'm wording the question right, but the effects that assisted suicide have on their family, patient's family.
Okay, the effect that assisted suicide would have on the patient's family. That's very interesting, actually. So what would you think would be a way that you would collect that data?
I was just going to look at the other research, the other studies that happened, but if I would have to do it myself, I could go to like hospitals for the terminally ill.
Okay.
Hospice patients.
And what would you do? What would be your data collection strategies? How would you get the information that you're looking for?
I would really want to question the family.
Okay, so do some interviews. Okay, great. That sounds like a very interesting study. Who else has a qualitative study? Everybody else is doing quantitative? Mm-hmm. Qualitative. You holding out on me? Come on now.
My study, my study is on the effects of exercising, well, how exercising during pregnancy affects the amount of complications that is experienced during the delivery.
So how the amount of exercise during pregnancy affects the complications?
Or not the amount, but just exercising at all, if it has an effect on if they experience complications.
Okay, so if the fact that moms or pregnant women are exercising during pregnancy, if that has an effect. Okay, that's very interesting as well. What made you think of that?
Well, recently I've been reading a lot about like death rates from pregnant women dying during that delivery process. So kind of like seeing if there is a way to prevent that, not necessarily prevent the death, but like kind of like
Predict.
kind of like a way to address the issue.
Okay.
And work towards better outcomes when it comes to delivering a child. So kind of to address the issue and give pregnant women something to do in order to kind of decrease those chances.
So now it kind of sounds to me quantitative study than a qualitative study. Now the reason I say that, you're on the fence. Well, there is mixed method design as well. So the reason I say that is because you're looking at a potential cause and effect, a causal relationship. And and we'll get to this a little later, although qualitative doesn't necessarily have causal relationships, there are some researchers that feel like there is a component of causality. So it just sounds more like a quantitative to me. So I would just look at that to make sure that your design is appropriate and you're asking those key questions that you may need to in order to define whether it is one versus the other. Does that make sense? Okay, cool. Thank you for sharing. So, and we're going to start now talking about those design features that you all, this is from chapter 9 actually in your text. So some of the things that we have already previously discussed, and these are the questions that you would want to ask in order to determine if the design approach that I'm thinking is actually the correct one. So for example, will there be any interventions? So typically in your qualitative designs, are there interventions? No, there are not. So this would be considered a non-experimental design or an observational design because we as the researchers are going to be observing, and again we're going to get into those specifics here in just a few moments. What type of comparisons would be made to illuminate the relationships? So are there comparisons? Some researchers say not, but then other researchers say that there are. So let me look, I wanted to read something in regards to the comparisons out of your book. So there was a qualitative comparison. Olson and co-researchers, 2015, studied patients' decisions about undergoing transcatheter aortic valve implantation, putting a catheter in your aortic valve, for those that were suffering from severe aortic stenosis. They identified 3 distinct patterns of decision-making in their sample of 24 patients, okay? So small study, as we know, qualitative studies are typically small sample size. These patients were either ambivalent about the treatment, in other words, they didn't know whether they wanted to have the treatment done or not. They were obedient and willing to let others decide, or they reconciled and were accepting of the treatment. So this study basically showed that there were patterns that emerged that shows that there were some comparisons. We took these 24 people, they had the same medical problem, they were given a choice, and so they made, we were able to compare based upon what they wanted or how they felt they should proceed with their particular treatment. So in regards to comparisons, there may or may not be comparisons in qualitative studies. What about control over confounding variables? Is there control in a qualitative study? No, they're not. Very good. What about blinding? Who remembers what blinding is?
If the patient knows if they're not getting
It's like
or getting
a placebo effect.
Okay, so just the patient. Who else?
It could also be a
The
physician. We don't
physician.
know.
It could be anybody that's involved in the study. So it could be the physician, it could be the data collector. So we want to make sure that we're protected from that. What about time frames? How often is data collected?
So you can do like weekly, monthly,
Okay,
yearly.
you can do. So qualitative studies can be either cross-sectional, which is at one point in time. So, for example, patient teaching at discharge. So we're going to teach patients how to change their wound dressing, and we're going to teach them at discharge. So that would be cross-sectional.
Because it's at that one.
It's at that one point in time. What about longitudinal?
Over a long period of time.
Either over a long period of time or relegated at specific points in time. So we could be looking at, let's see, the treatment of cancer treatment for those patients with lung cancer diagnosed after the age of 35. And we want to look at periods of time at 6 months post-initiation of treatment, so at 6-month intervals. So we're looking at 6 months, 12 months, 18 months. That will be considered a longitudinal design because we're not just looking at today, this one point in time, because we want to compare what's happening over the course of time. Make sense?
Yes.
Okay. Relative timing. When will effects be measured relative to the potential causes? When will information be collected? So it could be retrospective. What does retrospective mean?
You go back.
In the past. So something happened and we want to look back. And what about prospective?
You look forward.
You're looking forward to see what outcomes occurred as a result of. Cool. Location, where will the study take place? That's pretty easy. In qualitative studies, where does the study typically take place?
Where the informative in their area.
In their natural environment. You know, as I was preparing for this, and I'm thinking about qualitative studies, now you guys are young, so you may not have this point of reference, but I could just see those researchers like back in the day in the forests or in villages and tribes like Aboriginal, and they have war paint on their faces because they have interjected themselves into the society that they're studying. So we're gonna talk about that in just a moment. Now let's look at the research traditions. Those traditions basically are the different approaches to conducting qualitative research. Now these approaches dictate the type of questions that we're going to ask and the methods for answering them, okay? The different types of questions and the methods. And we already talked a little bit about causality. So if you're following the book, you'll see that just after this point, okay? So we're going to look at ethnography, phenomenology. We'll talk a little bit about hermeneutics, grounded theory, and then historical research, okay? So keys being, let's look at ethnography first. Ethnographic studies basically describe and interpret culture and cultural behavior. So what does culture mean?
The way people live.
The way people live. Their values, their traditions, their rituals. For example, give me an example of a cultural ritual or a cultural tradition.
Kwanzaa. Kwanzaa.
Kwanzaa is one. Yes. What else? Jumping the broom.
Definitely.
Definitely cultural. Do you jump the broom in your culture? No, he's like, I don't even know what that is.
No, I know what it is, but no.
No. Ms. Martinez, do you jump the broom in your culture?
No, but I feel like I've heard of people doing that though.
Globally or culturally?
Culturally.
Okay, interesting. So sometimes, you know, there are cultural traditions that kind of transcend cultures, and it may not be exactly the same, but they kind of pick up. Can culture change?
Yes.
Yes.
Give me an example. Yes.
Like, I don't know if I don't know. My example would be how we used to dress like in the 2000s, early 2000s to now.
Okay. What's the difference?
African American cultural change would be like the clothes used to be bigger and oversized, and now it's more fitted and it's skinny jeans.
Okay. Alrighty, so fashion culture. I got that. I'm with you. Absolutely.
Well, I changed my mind now with that example. I think culture, I don't want to say it changes, but I want to say sometimes it'll go out of style and come right back.
Well, with fashions, yes, I can definitely see where that would be a point. What else? Somebody give me an example of how your culture can change. Remember, culture, activities, the way people live, traditions, rituals. Yes. Oh, yeah.
I mean, the food we eat.
The food we eat.
More
Okay,
things
tell me.
are accepted. Is that what you mean? Like more things are accepted now in these days and times than it was back then?
Like what?
Same-sex
Like
marriage.
sexuality.
Absolutely. So that's more of a global cultural acceptances, but yes, I can see where you're going with that. Yes, ma'am.
Say someone marries someone who changed their religion, and if they're like Muslim, they don't eat pork.
That's kind of what I was looking for, although the others definitely apply. Give me 1 second. Absolutely. So let's say you marry someone of a different religion, and you know they have different practices that they were raised up with, as do you, and somewhere along the lines the lines kind of get blended and melded. So now it's not so much separate. You know, you have taken some of his traditions, maybe he's taken some of yours, and now you have created your own culture, your own traditions, your own rituals. Very good. Yes, ma'am.
I was going to say, like, I feel like the culture can kind of evolve, like, similar to the Native American people, like, way back a long time ago. They may have done their rituals more often, but now they, like, I've seen on, like, social media, they might just do certain rituals in, like, days of celebration, not the everyday, like, we're going.
So why do you think that example? So if you didn't hear her, she said for Native Americans, you know, back in the day, if you would, they had very specific ritualistic traditions that they did all the time. But now we have seen that some of those kinds of things have changed, and they may only do the significant ones and not maybe their ones that were done weekly or daily. Why do, and I'm asking everybody, why do you think that has changed? Yes. May not have been passed down.
Just started to not get passed down.
Okay. Excellent. Yes.
We don't have a lot of Native Americans that practice that here.
Okay. We don't. So if you don't have a lot of Native Americans in our area, then we wouldn't necessarily see those rituals or traditions. But typically, I think society changes. We don't have access to certain things, and people change, so they don't pass down those things from one generation to the next. So nobody knows how to cook good collard greens anymore because nobody's cooking good collard greens these days. Yes, sir. You do. I need to come eat with you. Yes, sir.
I think another example would be culture, where in some Asian cultures and African cultures, where if you look at someone in the eye, it's seen as a disrespect, but as you from here, it's more you gotta adapt to it, so it's termed as respect and protecting her.
Yes, and that's a very good one, actually. So we want to make sure that we understand what the accepted cultural practices are where we are, so that we don't intentionally offend people just by virtue of being who we are. Excellent examples. Thank you very much. So in ethnography, that researcher is going to become ingrained in that culture. Now you can have macro ethnography, basically where you're looking at a global or a very large area of study, or a focused area. For example, things that occur in everyday life. Someone may look at the number of infants that are admitted into a NICU in a major metropolitan hospital inside of a 7-day time frame. So we want to make sure that we understand the differences. And one of the key components is for that researcher to understand that culture, like we've just talked about so much, is it's going to take extensive labor-intensive field work. He's going to have to be the one sitting in the little hut there with the little painted on the face and, whatever, because he's going to have to become a part of the culture in order to get what he's looking for in that respect. All right. What they're looking for, you have emic and you have etic. We're looking for, or the researcher is looking for, the insider's view. One of the villagers, one of the family members, they become very much ingrained in the culture in order to get the information that is deeply embedded within the culture. Now the difference is, okay, let's say y'all bring me home for the weekend, right? And your grandma's funny about people anyway, okay? But I want to experience everything that's going on. Grandma may not be accepting, so I may not be able to get that insider view. I may only be able to get the etic or the outsider's view because I haven't been accepted, I haven't been trusted, I haven't truly been invited in, okay? Mm-hmm. And this, what we're looking for is tacit knowledge, which are those cultural activities and knowledge that are so deeply rooted. Sometimes they're just so naturally occurring that nobody even really talks about it because it's just the way that we do things. It's not anything extra or special, it just is. Okay? Now, this kind of information relies on a wide range of data sources. We are basically looking for cultural behavior, cultural artifacts, and cultural speech. Now, some years ago, cultural speech in the African American community changed. What did they call it? Ebonics. Yeah, going back.
We still use Ebonics.
Do they still use Ebonics? But you don't hear about that term too much anymore. So I would venture to say that when you are with your peeps, your conversation may be a little different than when you are here in your nursing class, right? Because maybe not. These are your peeps. Okay, so what happened? Your culture changed a little bit, right? But what's acceptable in this environment may not be acceptable in another environment, and vice versa. When you go to your clinicals in the hospital, is Ebonics going to be acceptable? Okay. So we're going to have to learn how to adjust, right? Okay, so we have to, you know the old saying, when in Rome you do as the Romans do? But what we're looking for is we're trying to get as much data, the researchers are trying to get as much data as they possibly can about that culture. Artifacts, what are artifacts?
Anything that's like to your culture, I guess.
Like what?
Like your grandma's wooden spoon. would
Your
be an
grandma's
artifact.
wooden spoon. That's an artifact. There's a story behind that wooden spoon. What'd your grandma make with that wooden spoon?
She hit me with it.
Ah, that was the paddling spoon.
Get smacked with it. I mean, she'll stir something too, but you get smacked with it too. Double smack.
That's important. So we're seeking, researchers are seeking to observe, to ask questions. They're looking for records, photos, diaries, and really participant observation. Participant observation is where the researcher is observing while he or she is engaged in the actual cultural activities. Makes sense, right?
Mm-hmm.
Again, we are looking for a holistic portrait of the culture. Not just one aspect, but in totality. All right. So what key points are you going to take away from the ethnography discussion? It's about 4 of them.
Yeah.
Okay, emic is one. What does emic mean?
The perspective you're in there.
Okay.
They treat you as a member of the family.
All right, insider view. Okay, yes, ma'am.
I just have a question.
Yes.
Because in our book it says the ethnographers also enlist the help of key informants to help them understand and interpret it. Who would be those key informants?
Well, it depends. If when y'all were talking about quantitative study earlier, and you were talking about, ooh, that thought just flew. Oh, there it is. Experts. So maybe if there's an expert in the community, let's go to like a medicine man, for example. He's the person in the culture that takes care of folks when they get sick. So if I want to look at health traditions or how certain ailments are treated in a culture, then my key informant may be the medicine man. Somebody that has key information that maybe nobody else has, because he's going to have a perspective different than anybody else. Make sense?
Yes.
Okay. All right, what other key points you got for me? Yes.
Understanding culture, and maybe that since we discussed it, that culture is constantly changing.
Yeah.
So not have like one mindset of probably what you're going to be observing.
Very good. I like that. Not to have one mindset. And that's really important in ethnography because we want to, again, experience the culture such that it is. We don't want to come with those preconceived notions, oh, this is how they are. So that ethnography really is the description and interpretation of culture and behavior. So that would be a key point. Yes, ma'am. You had your hand up with the hat on. Yes. I'm sorry, I don't know your name.
Me?
Yes.
Oh, I didn't know.
You did. She retracted. Yes, Ms. Martinez.
Because if you are studying a community,
Mhm,
okay,
mhm.
and they just do things nonchalantly because that's just what they do, being the person studying it has to be aware because they may not be aware that
That is
this
correct.
occurring.
That is
So
correct.
You may be able to point things out from your researching point of view.
Very good. Yes. What about data sources? Where do we get the data from in this type of study?
Fieldwork.
Fieldwork.
The actual person with the painted face.
The actual. I just always had that vision. I know it's kind of skewed. I'm sorry. I've scarred you for life there. The words, the actions of the group, what they actually say, you know, what they're telling us as we are a participant observer. What does that mean, participant observer?
You're in the group at this point.
You are in the group. You are observing from a point of being in the midst of. Okay? So I'm not sitting back like I've been doing, sitting back and just kind of watching. Now I'm a participant observer, actively engaged. Okay. All right, I have a little case study for you. Jordanian mental health care setting. Okay? So here are the few things that I want you to ponder as you're reviewing that really quickly. I want you to think, and we're going to discuss this, what do you know about this particular culture, Jordanian culture, okay? Then I want you to tell me what is the purpose of this study. What is the purpose of the study? What are the data collection techniques? What was the time frame? What were the main themes that were identified? And what were the recommendations? And it's not a long one, so it's not going to take you but just a few minutes to figure these few things out. What is the purpose of the study? What are the data collection techniques? How long did it take? What are the main themes? And what are the recommendations as a result of the study? All-seeing oracle. Okay, Jordanian, it's on the, say that again.
It is on the east bank of the Jordan River.
Okay, so what does that tell us? What do we know about the east bank of the Jordan River?
Biblical.
Biblical, okay. What else? Arab, okay. Muslim, different religion.
Different cultural beliefs.
Different cultural beliefs. So one of the things that attracted me to this, and I'll just tell you from the beginning, is that this says, it's reading from the abstract here, the nursing discipline in the Middle Eastern country of Jordan presents an interesting paradox. That nursing students, such as yourselves, study Western texts and are taught Western nursing models. However, the assumptions behind these concepts might be different from the cultural values and beliefs of Middle Eastern countries. So what are we up against already? Cultural barriers, absolutely. Maybe a little like, I don't know about this. So when I first read this, I was like, oh, this is interesting. Because now we're interjecting our Western culture, if you will, on a Middle Eastern country in regards to mental health practices. Okay, so what is the purpose of this particular study? Very good. So very, very specific, very detailed. They want to explore and describe. Explore and describe. What techniques did they utilize in order to get the information they were looking for?
Observation and interview.
Okay, so much like you said earlier in your proposed study, you want to talk to people about how they feel regarding assisted suicide. Okay, how do nurses, how do patients feel about perhaps the mental health services that are provided or available in the Jordanian hospital system? How long did it take for this data collection to occur?
3 months.
Okay, and where was it done?
In the mental health care setting.
In the mental health care setting, exactly. Now, this uses Leininger's theory, and I know you probably haven't done a whole lot about different middle range theories, but Leininger is a transcultural theorist who says knowing and understanding different cultures as it relates to nursing and healthcare practices, beliefs, and values. So that was the theory that the researchers applied, because we're talking about different cultures here. But we're talking about something that's universal, which is nursing care. Okay, what were the main themes that were uncovered or developed or discovered?
That the mental health care system needed like adjusting.
Somebody's reading, but I don't know what you're saying. Speak up for me.
The journey from community to hospital and back to the community with lack of resources and obstacles to provide standard care. The establishment of the new model unit. They look into the future, the stigma of mental illness, and social response and responsibilities.
Would you say that any of those themes that were uncovered might be similar themes here in the United States?
Yes.
Which ones? Give me an example.
The lack of back and forth from
Yeah.
the hospital.
So going back and forth from your home or from your community to the hospital might be an obstacle even here. And we have transportation and, you know, are, for the most part, a lot more resources than you would think in Jordan. Although there are some folks there that are pretty, you know, affluent, I would venture to say. And then what were some of the recommendations?
So, practice, education, policy, and future research.
So the great thing about research studies is we always want to look at how we can either apply this to actual living, if you will, or what things were left out that maybe it will spark or spurn another research study, and that's called a gap. So there are a lot of things that this information in this particular study can lead to going forward. So that, I think that was a fairly easy one to critique, if you will, but you see how it's laid out. Not very difficult at all. Okay? Thank you for your participation. Now we're going to move on to phenomenology. Excuse me. Phenomenological studies typically surround fundamental life experiences, such as the meaning of suffering or quality of life by those who have chronic pain, for example. Okay? In phenomenological studies, researchers want to get to the essence of an issue. The essence is really the basis of what the issue is about. And it is about describing and interpreting lived experiences. Lived, meaning right now, in this particular point in time. The studies are typically small, maybe less than 10 participants, and they want to get inside the informant's world to access experiences as they occur, and they want to experience the phenomenon. What kind of data do you think would be collected? How would we collect the data in a phenomenological study?
Through
Interviews.
Conversations.
Yeah, in-depth conversation. So it's not just a surface, oh, well, you know, kind of tell me what you did for the last 7 days when you were experiencing that pain and discomfort. They want like details, down to the nitty-gritty kind of thing, okay? So there are different types of phenomenological studies. Herschel's question that he felt like needed to be answered was, what do we know as persons? So descriptive phenomenology is going to describe the human experience. They want to know the things that people experience. The things. What are people hearing? What are people seeing? What do they feel? What do they remember? And one key way for these researchers to chronicle those experiences and that information is to do a reflective journal. Or a reflective journal basically helps to keep the researchers' thoughts and ideas current. Because as you know, if I'm having a really detailed conversation with the three of you, and I'm not recording, and I'm not writing it down, because sometimes people are really freaky about, you know, you're writing down what I'm saying. Mm-hmm. You know, so when we're done now, I have to go and I have to transcribe what I thought about what you all said, or the information that you shared, or what I saw, or what I experienced. They want the readers to see something differently as a result of the study. Now, there are a few phases, four specific steps that are involved in phenomenological studies. Bracketing is one. Bracketing basically identifies and eliminates bias, any preconceived notions. So we want to make sure that in this particular situation, I don't feel some kind of way, or I don't have a bias or prejudice about the experiences that I'm getting ready to live through with this individual. Okay, bracketing. Intuiting is when the researcher remains open-minded to the phenomenon by those who've experienced it. So we're not looking for a specific thing. We're just, okay, whatever comes my way, I'm going to be open to it. Analyzing, of course, is processing the data. And then describing is going to be interpreting the data to come to a specific understanding about the phenomenon that we are involved in. So it's kind of easy to recognize a phenomenological study, a descriptive phenomenological study, because it'll speak to bracketing in the description. There's one other, I'm going to come back to that, called the interpretive phenomenology. And this is based upon Heidegger, who is like an offshoot of Husserl. And interpretive is when we basically, or when the researcher enters another person's world and discovers the understandings of what's going on in that world. So whereas descriptive is to describe, interpretive is to understand. Interpret it, come to an understanding. Again, in-depth interviews. Interpretive researchers are open to hearing what the text is saying or what the information gives them. They come to the study with knowledge and understanding, so no bracketing is an issue. So, another quick case study. This one's even faster than the other one. Everybody get one? Only three things this time. What's the purpose? What's the design? What's the study design? And what are the results? So this is a phenomenological study on nurses' experiences and understanding the comfort of children at the end of life.
That's the purpose.
Okay, so what's the purpose? Okay. And you know, whenever you hear something like that, it just wrenches your heart. So you can imagine why this study is being conducted on nurses, their experiences, and understanding how these children feel. Okay? What's the setting and design?
Setting is qualitative phenomenological design.
So what does descriptive design say that we should be doing?
Have like an in-depth conversation.
Okay, so we're going to have in-depth conversation or interviews, right? Right, description, yes, understanding, describing the phenomenon, describing. Interpretive is going to be more understanding. Okay, so describing what's happening. And what were the results? They had 6 themes that they came out with, right?
Mm-hmm.
They wanted to reduce children's suffering,
Realize that children were wanted.
realize that the children were wanted. What else?
Observing the children that felt comfortable in their families' acceptance of their condition.
Mm-hmm.
Facing internal and external conflict. And then experiencing mixed feelings, knowing that the children's conditions and requiring support for all parties.
Yeah. So, if that's the reason I gave you like I didn't give you the whole study, but in the event that you wanted to go back and do a little bit more reading on those, that's why I wanted you to have that information. And it goes on to say, as part of the results, that the nurses were not bothered when some of these children passed, because they were able to have in-depth understanding of what their feelings were. So studies have value. Okay. I think we did that previous one, didn't we? Yes. Hold on, I'm confused. Yes, we did that one. Okay. So, question. What process is associated with descriptive phenomenology? Which one of these processes? Everybody concur?
Mm-hmm.
Very good. Descriptive phenomenology involves those 4 steps we talked about: bracketing, intuiting, analyzing, and
Descriptive.
okay, very good. Again, lived human relations, that lived experience. All right, we're going to talk about grounded theory right quick here. Grounded theory focuses on people's actions from the perspective of those individuals who are actually involved. They want to identify the main concern or problem and then the behavior that's required to resolve it. Grounded theory. So basically, they're looking for a social process that emerges through analysis and data, and it actually produces the resolution to the problem. So some of the methods used in grounded theory were how people make sense of social interactions. And primary data sources for grounded theory, just like most of the other phenomenological studies that we have discussed, is in-depth interviews. But the difference is we're looking at about 20 to 30 people, not maybe 5 to 10 of some others. Now these data sources, not just interviews, but also observations, written documents that your research subjects or your participants may have in their possession. So again, data collection, you know what that means. Data analysis, you know what that means. And sampling all occur at the same time. Grounded theory. The key here is there is a constant comparison that is used to develop and refine the relevant categories. These categories basically emerge from the data that is constantly compared with data that was obtained previously. So it could be a study so that they can compare and contrast. Well, is this experience here in March of 2019 similar or different experience from March of 2015, for example? And if not, what are the variations that occurred? What are the differences or what are the similarities in those particular time segments? Okay. They want to understand a central or core variable. What is the problem and what is the problem solution or the resolution that has been identified? So one study, Johansson, 2015, used a constructivist grounded theory to explore orientation in the early recovery phase following colorectal cancer treatment. Data were gathered through in-depth interviews with 17 patients 3 months and 9 months after surgery. So comparing the two, comparing 3 months after and then 9 months after. All right, historical research. Historical research is pretty straightforward. Basically, we're looking at written records, diaries, letters, newspaper articles in order to collect data that relates to past occurrences. So think about maybe World War I. Could you imagine living back then, being a nurse in World War I? So here we are in 2019. We want to know what it was like for nurses just like us to take care of patients maybe with tuberculosis, which was a prevailing medical indice at that particular point in time. So we would look at medical documentation, health records, newspaper articles on maybe the prevalence of tuberculosis during that time, historical research. And we're using those records to examine the phenomenon, recent now versus what happened then. How did they treat tuberculosis then? How do we treat it now? What was the prevalence then? What is the prevalence now? Do we see tuberculosis very often? No. And why don't we? Because of things that they did back then that have helped us to be able to come up with treatments that not necessarily would eradicate it, but would identify it and we would know how to treat it. Other types of qualitative research is case studies. You know what a case study is, basically, because as nursing students, well, I don't know, you may not have done case studies yet, but as nursing studies, we do a formal, thorough description, explanation of a single case. This patient has tuberculosis in 2019. We want to do a case study. How did that happen? Where has he traveled? Who has he been exposed to? That would be a great case study to do. And that data is going to be collected, not just here today, but now he has it. We got to figure out how he got it, right? Where did he go? What did he do? Blah, 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 blah. Now, what's going to happen 6 months from now? Does he still have it? What is the treatment protocol? Case study. The one thing that you need to be mindful of, however, is that oftentimes case study researchers may lose their objectivity because they may become too close to a particular situation, depending on the parameters. All right, is this statement true or false? When applying grounded theory methods, the researcher obtains the sample first and then collects the data. Which one is it, true or false? When applying grounded theory methods, the researcher obtains the sample first and then collects data. So what's the right answer?
You would
simultaneously
do it both at the same time.
All right, very good. She's writing good notes. Good stuff. Just a couple more and we'll be done with this section. Narrative analysis. People make sense of their world and communicate the meanings by telling stories. And then their stories are analyzed. Narrative. Narrative is a story. Narrative analysis. Let's see. An example would be Tobin and colleagues conducted a narrative analysis of asylum-seeking women's experience of childbirth in Ireland. 22 mothers told their stories during in-depth interviews lasting from 40 minutes to 1.5 hours. Highlighted in the narratives was lack of communication, connection, and culturally competent care. What does culturally competent mean?
Aware of the cultural norms, understanding their cultural practice.
Excellent. Yes, you're all correct. And you're providing care according to those cultural differences. So this is very interesting because, again, asylum-seeking women, so what that tells me is women that were going to asylums, right? Their experience of childbirth in Ireland, they told their stories. So what prevailing themes were lack of communication, lack of connection, and lack of culturally competent care for those individuals. So again, making sense of the world and communicating the meanings so that we can do something about it. Researchers can affect change. Then you have those studies that we think are qualitative, but they don't really fit into any particular discipline or methodology. They tend to be eclectic. They do seek to holistically describe phenomenon. There are patterns and intent of understanding those patterns. They're not necessarily interpretive, they're not phenomenological. Those things do exist, just so that you are aware, they do exist. And in ideological perspectives, two here, critical theory research and feminist. Critical theory is concerned with critiquing existing societal issues and opening up new possibilities or new changes that may come as a result. Transformation in critical ethnography is the key objective, to transform, to change behavior. To make people aware of contradictions and disparities in social practices and to become inspired to change them. If you don't like the way things are working, then what do? You change it. And that's what this is about. And then feminist research basically focuses on gender domination and discrimination. Gender domination, being in control, and discrimination. Researchers seek to develop elaborate, non-exploitative relationships. So I don't want to, I'm purely there for the purposes of research, nothing more. They want to determine how gender and gendered social order have shaped women's lives. Gender and gender social order. Sutherland and colleagues used a critical feminist lens in their study of the processes that shape gender inequities or disparities, unfairness, inequality in hospice and palliative home care for seniors with cancer. Gender inequalities. So does that mean, were they looking at how women were treated, those individuals, those women who were on hospice care, were they treated differently than their male counterparts? Interesting. All right, question, last question. Which phrase best describes the key objective of critical theory research? I heard one loud voice. You agree? All right, that was a good agreement there. Transformation. Remember, we want to change things. What's wrong? What are the societal ills? And what are we going to do to change it? All right. And so I wanted to end with this. Find the two cats.
One is laying in a lady's lap. And then the other cat.
What's on the girl's shoulder?
I don't know.
Oh yeah, that is a cat in the lap.
There's a cat
Okay,
on
so
her
everybody
lap.
says that there's a cat on her lap.
Yeah.
Okay, got that. Where's the other one? On his head?
No.
Okay. I know.
Is it on the lamp?
Or on the girl's shoulder?
Now, I'm going to say this. I can only see the one. The reason I ended with this is because when you're a researcher, sometimes what you see is very different than what other people see. In this instance, we all saw the one on the lap, okay? But there's another one in there somewhere. But can you find it? How are you going to find that answer? What are you going to do as a researcher to prove your point, to get the information, to come to the social change? What are you going to do? What do you see differently? Interesting. Interesting. Okay. This concludes this portion of the lecture. Thank you very much.